Hi, I'm Diane McGarry with Drake at Arts. With me today are co-host Tom McGarry, Chaplain Lauren Rigsby, and ASL interpreter Judy. Lauren is a chaplain and the manager of spiritual care at Tufts Medicine Lowell General Hospital, where she has worked for the last 9 years. Before working at Lowell General Hospital, Lauren earned a Master's of Divinity at Vanderbilt University Divinity School and completed a clinical pastoral education year-long residency at a live hospice in Nashville, Tennessee. Lauren lives in Boston with her wife, Brianna, and their wonderful little curly dog, Quincy, who also likes to boat, just like mine. I asked her here today specifically to talk a bit about issues around death and dying, because our wonderful soprano Jane Shivik's January arts performance is presented in honor of her husband, who has passed. It was Jane's way of honoring him, a requiem of sorts for her husband. Lauren, could you share other ways that people honor their loved ones and express their grief?
Absolutely. Hi, everyone, and thank you, Diane and Tom, for inviting me. I'm very grateful to be here and talking about this. I was very moved to hear Jane Shivik's Requiem, as you called it, and so grateful that she is finding ways to honor her husband's life and their relationship. We all need ways to feel and express our grief and honor our loved ones who've died. And the details of how we do that get to be individual. They get to fit the contours of each person's life and interests and the shape of the relationship with the person who died. One example that comes to mind after my brother-in-law's death is his coworkers gave his kids pillows made from his police uniform. And the act of making that pillow was a way to honor him and his work. And now his kids have a tangible pillow to hang on to hug when they think of and miss their dad, which is a way to continue the relationship.
That's so sweet.
Yeah. Similarly, I hear a lot about quilts that loved ones make of their deceased loved ones, t-shirts of their PJs, dresses, flannel shirts, which sounds wonderful and cozy. Again, something that can be tangibly hugged or hug around you. Many people find memory boxes and photo albums very meaningful as tangible items that they can visit, that they can spend time with, be in relationship with the person who has died. Memory boxes and photo albums and things like that can also be set down or closed for part of the day. You can walk away as well as choose to go visit, which is helpful.
Yeah.
That's how grief works most visibly with children, but it's how it works for adults too. Grief can be so painful that we tend to want to stay away from feeling that or from processing our grief.
Sure,
But
it
we
can be
need those
overwhelming.
Yes. Yeah, overwhelming. And a whole slew of different emotions, right? It's not just one.
Yeah.
So we need opportunities to experience that, to express the emotions that loss brings up, the whole variety, whichever emotions are coming up at the time, as well as the opportunities to step away, to focus on other things, on allowing ourselves to laugh at funny stories, to delight in a walk in nature, to do other things as well. And back to your question, people can be so creative in grief. A friend of mine, Karen Krolock, has a creative project that grew out of her grief that she has called the Dictionary of Negative Space, which is a digital and print dictionary for words that English lacks, for lamenting, words that just don't exist in our language. In this project, the word being defined is left blank. It It creates the negative space,
Mhm.
and it's given a number. Then it's defined and it's used in an example sentence. She has all sorts of different projects, but one example would be negative space number 134 is a noun. It's a last meal with someone.
Oh, wow.
Yeah. So in an example sentence, if their daughter could have predicted that this would be their negative space number 134, would she have spent so long in the furniture store before meeting them?
Mm.
It's an incredible project. Karen Krolak has all sorts of really creative projects, and this is one that I think is very meaningful.
Yeah.
To go in a
Want to feel guilty about making those choices either, because we don't know always when death is coming, and we also are alive.
right.
Are there any examples of, I don't know, things that you're really glad you did so that your loved one could experience it, or, last time they experienced it? There must be some like that.
Absolutely, yes. There are all sorts of different examples in that project. One that I noticed the other day was a space that is intentionally safe for grief.
Hmm.
Because some places we feel like we can feel what we're going through, and other places are not safe for us to experience and feel what we're going through. So yeah, there's all sorts of different directions to go.
Some people are safer than others as well.
Yes.
In Jane's story, her husband died in the hospital. What does end-of-life care and dying look like in a hospital now?
Thankfully, very different from when we were at the height of some of the waves of the COVID-19 pandemic.
Mhm.
Hospitals always try to prioritize loved ones getting to say goodbyes. We always want to offer comfort and treatment of pain and treatment of any discomfort symptoms, patients who are at end of life. That said, there are really two different, or I could group into two different types of end of life care in the hospital. It can look differently depending on the situation. I can oversimplify and say there's crisis care that might result in death, or there's a more palliative approach to the end of life care. And in the crisis care group, sometimes patients are so critically ill that they don't survive, even though they're receiving all possible curative treatments. We think of this in the emergency room or in the intensive care unit. As a chaplain, I might get called to support patients' family, loved ones, when the medical team knows that they're already doing everything and the patient isn't getting better, or maybe when the patient is already receiving CPR, for example. These are traumatic deaths. They're difficult. And the hospital staff does everything we can to try to find ways to tend to not only the patient's needs in those crisis moments, but also the family and loved ones' needs at the same time. And then switching to the other group, the more palliative approach, they're patients who have the chance to get to make the choice. They get to choose to transition the goals of their medical care to focus on their comfort at the end of life. If someone learns that they have a terminal or life-limiting illness, and they can choose to spend the rest of their life focused on what quality means to them, what quality of time means to them. This can look like signing on to hospice, or in the hospital, sometimes called care and comfort or comfort measures only.
It's so important to discuss all of that with your family and friends beforehand, though, isn't it? Like when you're healthy.
Yes, yes, that is exactly right. That is a number one takeaway every time I tell these stories or talk about this topic is everybody should have a designated person or a couple of people who have the legal authority to make decisions, healthcare decisions. If there's ever a time that you can't make your own healthcare decisions, and those people should know what your wishes are.
Yeah.
And there's a few ways to do that. There's several legal ways to do that. It can vary a little bit state to state, but the premise is the same. One, you can always go to a lawyer. You can appoint a durable medical power of attorney, and a lawyer will help make sure that legal paperwork is completed in a way that is required by the state. And filling out a healthcare proxy form with 2 witnesses is super simple in the state of Massachusetts. You can do a quick internet search for 5 wishes or honoring choices and find the forms themselves as well as instructions on how to complete a healthcare proxy.
Mm.
Documents like 5 wishes and the conversationproject.org, they can both help you start to think about what your wishes are at the end of life, because we have to take time to consider that for ourselves before we tell someone else. And then they can help walk you through how to have conversations with your loved ones so that they know your wishes.
I've tried it so many times with my kids, and they always say, "You're going to live forever, Mom," which of course is not true.
Right,
It's
right.
such an awkward thing to do.
It's scary. It's scary, it's painful, and it's difficult. So there are resources that help give you some scripting of
Yeah.
how to bring it up, who to bring it up with, the timing, some phrases. There is some help out there. It's still awkward and scary and difficult.
Yeah, it is. It's not like, what do you want for Thanksgiving dinner? And or you're a vegetarian now? You don't want turkey? What are we gonna
Right, right. Yeah, we have to face not only for mortality in the abstract out there, someone else's, but my parents, my loved ones, my spouse, that's different. That's a different conversation.
Yeah, it's very different. What are your concerns about medical treatments? And I know my dad had a heart transplant, and that puts you in a whole different level of care than something I would want. I actually hate to say this, but honestly, when I had kids 30 years ago, I was like, I do not want a transplant. That was very clear to me, which my siblings couldn't understand. And actually, it gave my father 7 more years of life, so he couldn't understand it either. But it's those lines and those choices we have. How do we help other people understand them?
Mm. Well, I think you gave a great example of telling your story, of giving some context. And at the end of the day, even if our loved ones don't understand why,
Yeah.
that's the purpose of choosing someone who you trust to um, enact your wishes. That's because we know, based off of our conversations and our relationships, uh, who will follow, uh, even though you're a different person with different wishes, different goals, different limitations, then maybe they would choose for themselves. That's okay.
Yeah, it's really respecting and honoring other people's choices.
Absolutely.
What resources do the hospitals have to help families through this?
The whole treatment team is really involved in support, including the doctor or provider, the nurse, the social worker, the chaplain, all the different specialties, especially palliative care and hospice. The medical team provides support by listening to you, by answering medical questions, sharing their expertise and what to expect, and talking through treatment options. That should always include very clear understanding of risks and benefits. And nursing is there through it all. They're both, they're incredible.
Yay, nurses.
Yay, nurses. They're both, emotionally supportive, and they're ones actively giving the medications, helping physically reposition, keeping you comfortable. Social workers might help a family take a leave from work or help access community resources. They're always also experts at providing emotional support. And chaplains, this is a big part of our work. We will walk alongside a dying patient and their family and loved ones. We'll certainly do the religious part. We'll facilitate end-of-life religious rituals. For example, Buddhist chanting or Catholic sacrament of the anointing of the sick. We'll participate in conversations about values and wishes, goals of care. We'll listen and provide counseling, rituals about hopes and fears, about legacy, concerns about family or other relationships, and saying goodbyes. We do a lot of, I was taught this sort of 5 fingers approach of I'm sorry, I forgive you, thank you, I love you, and goodbye.
Mm-hmm.
And sometimes, like nurses, will sit at a dying person's bedside and hold their hand, especially the folks who don't have loved ones to do that, or don't have loved ones nearby to do that.
Yeah. There's a whole new no one dies alone movement now too, isn't there?
There is. That is a wonderful program that's been around for a little while, that different hospitals have different versions, and there is an official No One Dies Alone program, which is a great program. It teaches volunteers, including volunteers from staff within the hospital, how to sit with someone who's dying and provide that sacred presence at the transition time someone's dying.
You wanted to say more about palliative care.
Yes, thank you. So palliative care is a specialized medical care for people living with serious illness. And this type of care is focused on providing relief from symptoms and stress of the illness. They will certainly help you understand your goals of care, and then help translate and communicate your goals of care to the rest of the medical team. Their goal is really to improve quality of life for both the patient and the family, and they can provide guidance on what we're talking about, transitioning to end-of-life care.
Yeah.
And also, many hospitals and hospices have robust volunteer programs with different types of volunteers who might be available to all sorts of different patients, including patients who are dying and their families. Pet therapy, Reiki, and therapeutic music are some of my favorites.
If we circle back to grief, what is grief, and where can people access grief support?
Yeah, grief is our embodied response to loss, any loss. That's our emotional, our cognitive, our spiritual, our functional and behavioral responses to a loss, to any loss. It's how the loss affects us. Grief is, a normal part of life, because loss due to change and sometimes death are facts of life, right? It's both something that we all have in common, and it's so deeply personal, because my grief about The loss of my cousin Garrett, for example, takes the shape of my relationship with Garrett. My grief can change over time based on how I tend to it, how I take time to feel it and express it, eventually make some meaning of the loss and honor him, for example, and honor my relationship with him, for example. And there are loads of great resources if you want to dig into them, and I'm sure you have some good ones too. One type of resource are books like Julia Samuel's Grief Works. Julia Samuel is a psychotherapist in the UK and a grief counselor who has a number of lovely resources, including what's publicly available on her website as well as in her books where she works. She's developed these 8 pillars of strength to help us rebuild our lives after loss. The classic Elizabeth Kubler-Ross and David Kessler wrote on Grief and Grieving, and Kessler has since published a new book, Finding Meaning, the 6th stage of grief, that adds to that work in a really beautiful and important way. Another type of book resource might be poetic, like Jan Richardson's book, The Cure for Sorrow, a book of blessings for times of grief. That's a personal favorite. Being a chaplain, I like the books of blessings.
Yes.
Yeah. And, most importantly, it's love and connection to others that's really most important in our grief. All the personal work, the compassion on ourselves, and the projects that we do personally, all of that is only part of what's important. The other whole half is allowing our loved ones to show up and take care of us when we're overwrought. Finding a grief support group. Those now are pretty easy to join online and still possible to find in person. Most grief support groups are based on your relationship with the deceased. So they're for people who maybe lost a spouse or a parent or a child, for example. You can also find grief support groups for specific types of deaths, suicide, for example, or substance use or overdose. And there are activity-based support groups, which I enjoy, like knitting or hiking support groups, things where you're doing something together. And talking about resources, I want to make sure to mention that local hospice organizations have grief support counselors, and they can be really incredible resources. And the website, psychologytoday.com, can filter lists of therapists, not only by location and insurance, but also by the specialties, including therapists who specialize in grief. So if you get to the point where in your grief or in a loved one's grief, it's time to reach out to a therapist, there's ways to sort of narrow that field and find folks who specialize in grief counseling. And then there are specialty organizations, nonprofits in this world who do incredible work, like the Children's Room in Arlington, Massachusetts, which focuses on providing caring grief support for children, for teens, for families. And organizations like Junie's Place provide no-cost bereavement support for families in Massachusetts navigating losses in pregnancy, in infancy, in childhood, or stillbirth.
Those are so hard to navigate.
Yes, every part of why every loss is personal, and the way we process every loss is is our own. And some types of losses are more socially acceptable or easier to talk about than others. And these are definitely types of losses that are difficult to navigate, difficult to discuss socially. Good to have really strong resources for it.
Yeah. We're so lucky now that COVID is over in one sense, that we don't have to be isolated, because community and being able to reach out and touch each other is such an important part of healing.
Absolutely. Yes. Yes. And I'm glad that digital grief support groups exist. That has bridged a barrier that existed for a long time. And I'm so glad that the in-person ones are back. They're not as many as there were before pandemic, but they exist again, which is really important for a lot of folks. And talking about how difficult these things are, I should name that grief and loss can both be risk factors for suicide. So if you're concerned about thoughts of killing or harming yourself, please always call the crisis line at 988 in the US.
Thank you for giving us that. That's really important. I think we should pause and offer a moment of silence to honor our loved ones who have died, and to express gratitude for the many opportunities of care we have, of caring for each other in our grief and in our lives. And thank you so much, Lauren. Thank you so much. You are such a wise woman. I greatly appreciate you and your heart. Thank you for all the advice and information you've shared with us today. We're also, on a more mundane level, very thankful for our sponsors who make this program possible. We're first coming up with our authors that are highlighted, but here are our many donors. If you're interested in donating to our programs, please go to draketarts.com/donate. For more information about our programs, visit our website, draketarts.com, or email us at draketarts@gmail.com. This and all our programs are archived on the Drake at Arts YouTube channel. That's youtube.com/@drakeatarts. We care how all of you are doing. Thank you.